Hi, welcome back to my channel. My name is Alina. I am a registered nurse in Texas and I work in the NICU. Today I wanted to talk about what goes down in the NICU, what happens in the NICU. If you want to know more about the NICU, stay tuned. So today I really wanted to give you the inside scoop as to what the NICU is all about. NICU stands for Neonatal Intensive Care Unit. I'm going to be talking about the different levels of the NICU. I'm going to be talking about who's involved in the care of these NICU patients. I'm going to be talking about the types of patients that we have. I'm also going to be talking about what do you do as a NICU nurse, which is probably going to be the greatest highlight of this video. Let's get started. We have 4 levels in the NICU. We're going to talk about each and every single one. Level 1. This is usually a nursery. Most hospitals that deliver babies have a nursery. It can be either a mother-baby unit. It can also be a separate nursery. It just depends on the hospital. A level 2 nursery is a intensive care unit that is specially for premature or sick babies. Now this is a step above the nursery, but it is not a super critical baby, but they still require intensive care. A level 3 is a NICU that is providing comprehensive care for more seriously ill newborns and also for premature babies. So a level 4 NICU is a step up from the level 3. Now the level 4 has everything that the level 3 NICU does, but instead it's more specialized and they deal with a lot more critical babies. So they also have a pediatric medical or pediatric surgical specialist that's usually within reach 24 hours a day, 7 days a week. The biggest difference between the level 3 and the level 4 is that the level 4 has surgical procedures such as any type of cardiopulmonary disease or something like that. They use ECMO, which is extracorporeal membrane oxygenation, or they can also do cardiopulmonary bypass, and this is something that is not available in a level 3 facility. To wrap up all the levels in the NICU, level 1 is going to be your least critical to level 4, which is the most critical. Alright, for the second part, who is involved in the NICU? Now this is gonna be something that you probably didn't think about. There are a lot of people that are involved in the NICU to help with the quality of care provided for all of the NICU patients. Let's get started. So of course we have nurses, we have neonatologists, we have nurse practitioners, but what people forget about is that we also have nursing assistants, physical therapists, occupational therapists, respiratory therapists, dietitians, allied health professionals such as the X-ray technician. We have the ultrasound technicians, pharmacists, lactation specialists, unit clerks, housekeepers, and last but not least, we also have students. So I'm pretty sure all of us have heard the saying that it takes a village to raise a baby, and that is so true in the NICU. You need every single person to do their job. It can be from the students all the way to the neonatologist. Your role matters in the NICU, and without each component, it just doesn't function. It's so important to have every single member of that team there doing their job to make sure that we are giving the highest quality of care to these little miracles of life. So let's dive into the types of patients that we have in the NICU. So for gestational age, most of these babies are born less than 37 weeks or greater than 42 weeks. So you can see in the NICU anywhere from premature babies to babies that have extended their due dates. Number 2 is the weight. Now, for patients, their weight can vary a lot in the NICU. You can have babies that are less than 5 pounds, and you can have babies that are more than 10 pounds. So it really just depends on what the baby is going through. We have babies that are less than 1,000 grams, and we have babies that are large for their gestational age. Depends on what underlying factors are playing for that baby. So why are these babies in the NICU? We're gonna explore the baby factors, the maternal factors, as well as the delivery factors that might lead to the baby being in the NICU. So for baby factors, this baby might be needing medications or resuscitation at time of delivery, which is why this baby is in the NICU. They can also have birth defects. They might need special medications that are only available in the NICU. They may have respiratory distress, or they may need a procedure done. They may have an infection. They could have seizures. They could have low blood sugar, which is hypoglycemia. They may need a blood transfusion as well. Or they may just need some extra oxygen and monitoring. Now, these are just some of the reasons why a baby might be transferred to the NICU based on just the baby factors. So for the maternal factors, this does not in any way say that a mother is responsible for sending her baby to the NICU. That is not what I'm saying. I'm saying that sometimes there are special circumstances with the moms that may lead to the baby needing just some extra help. If a mom is less than 16 years old or greater than 40, they have a higher chance of a baby being transported to the NICU. They can have drug or alcohol use, diabetes, they could have hypertension, they could have excessive bleeding, they could have STDs, which may lead to an infection in the baby. They could have multiple pregnancies, which means you have twins or triplets. They could have too little or too much amniotic fluid, and they could also have premature rupture of membranes. So these babies can come in for fetal distress or asphyxia, breached birth. They could have meconium aspiration. They could also have nuchal cord, and they can also have a forceps or a C-section. There's a lot of delivery factors that can go into the baby being transported to the NICU. Next, we're going to talk about what do you do as a NICU nurse. This is going to be the highlight of the video, and I know everyone is staying tuned just for this part, and I am excited to share with you exactly what I do as a NICU nurse. So as a NICU nurse, I provide patient care to my babies. So that goes into assessment, diaper changes, give baths, I weigh the babies, give them medications, I reposition them. It's a lot more than just doing those things. Now for feedings, my baby can be NPO, which means that they're not getting anything by their mouth. I can also give oral feedings, which means that I am going to be feeding them via their mouth with a bottle. We allow mothers to come in and breastfeed their babies as well. Now they can also get feedings through an NG tube, which is a nasogastric tube, or an OG tube, which goes through the mouth. Both of them go to the stomach. And you can also give feedings through a G button. All of these are different types of feedings that may be possible. You also manage lines as a NICU nurse. So you can have a whole bunch of PIVs, you can have PICC lines, you can have Broviac. It just depends on your baby, of course, what kind of lines they have. They can have a lot of different medications running. They could have continuous infusions of D10 starter bag, you can have TPN, you can have a whole bunch of different types of fluids running. And you can also be giving IV medications such as antibiotics, you can be giving caffeine. So yes, we do have respiratory therapists. With the respiratory therapist, you are also responsible for managing oxygen therapy. Both the RNs and the RTs work together to provide oxygen therapy to babies. You can either be giving a nasal cannula, they can be using a high flow nasal cannula, they can be using CPAP, they could be a ventilator. It varies depending on what your baby needs. And of course, you are going to be talking with the interdisciplinary team, which means all of the doctors, the nurse practitioners. You're going to be talking with respiratory therapists, you're going to be talking with dietitians, with the physical and occupational therapists, the pharmacists. You're going to be talking with everyone to come up with a plan as to how to treat your baby in the most comprehensive way. So you as the nurse are responsible for not just your job, but also that everyone is doing their job in caring for this baby. Now, the last point that I want to cover, which I feel like is super important, is that you are a huge educator in the NICU. You are responsible for educating all of your parents. Why am I stressing this? Because these parents have given you their baby. They feel as if they are out of control. They don't know what's going on. They're not 24 hours, 7 days a week to take care of their baby like they would want to, and that's okay. They need to know what is going on. You need to educate what exactly is going on with your patients, what's going on with your baby, why is the baby in the NICU. You want to educate your parents as best as you can, because the more educated they are, the more likely they are to make better decisions in the care of their baby. This gives them the control and this gives them empowerment. Empowering them with knowledge is not only going to ease their mind, it's gonna help in better outcomes for that baby that you are responsible for during your shift. So a huge thing in the NICU is education. You are a huge educator. You are a teacher, you are a nurse, you are a manager, you are in charge of so much more than just doing assessments and vital signs and diaper changes. You are doing so much more than that. You are doing everything. You are a huge educator. If you want to be a NICU nurse, do remember that you're going to be a teacher, a huge teacher. So I hope this video is very helpful for anyone who is trying to go into the NICU. I knew I wanted to be a NICU nurse from before nursing school, so I always had that dream in the back of my mind. Not everyone knows what happens in the NICU, and in nursing school you have a very limited time in the NICU. I hope the information that I provided does help in you deciding whether or not you want to be a NICU nurse. And if you have any other questions, please comment down below and I'll be ready to answer any of your questions. Do subscribe for more nursing videos. If you have any other topics that you want me to cover, do comment down below. I hope to see you soon and I hope you have a great day. Bye.